Welcome, everyone, to the 2015 Neuroendocrine Patient and Caregiver Educational Conference. We're so excited you're here today. My name is Giovanna Joyce Imbesi. I'm the Executive Director of LACNETS, the program that runs at Cedars-Sinai. And we're very excited to have such an amazing agenda today. It's been many months of work, and we're pleased to have presenters from all across the US right here with us in Los Angeles. I wanted to make a few announcements. One is that the LACNETS website is officially launched. It's been months in the making, but LACNETS.org is now going to house all of our content, the videos from the monthly education speaker series, and lots more news and links to other groups. We're very happy to have the San Diego support group here. With those of you who are with the San Diego group, just raise a hand. Great. And I know there's a couple of other people who came up super early this morning and made the San Diego drive in record time to come help out and volunteer. And I want to thank everyone who volunteers. We had a great team here and continue to have people helping out. We are going to do something very special today called Zebramonials, and I'm going to credit Nancy Marsden with that name. If you just walk outside these doors, you'll see a large LACNETS banner, kind of like the Academy Awards. We'd love to invite you to come. You have a little sheet in your program to come and just say a few words about what the community has meant to you, and anything you'd like to share. It can be 10 seconds, it could be a couple of minutes, whatever you're comfortable with. So that's going to be happening on the breaks and at lunch and then just after our program. And I hope you'll come join us for that. It really is nice, especially for new patients, to be able to see other patients speak positively about their experience and how their journey has been. I want to especially say thank you to Cedars. Cedars-Sinai has been our home for LACNETS for the past few years, and it's just wonderful that we have this incredible auditorium for us. And let's give Cedars a round of applause for welcoming us here today. This room in particular is special to me because I think you may discover from the people in the room, there's many patients, caregivers, healthcare professionals, physicians. Life can change in a moment in this room, in this setting. For me, that was in 2009 when I met Dr. Woolen, standing right about there, and changed the course of my treatment. I became someone who participated in the clarinet study with lanreotide, and it completely changed the next 5.5 years of my life, which is now FDA approved. So it's changed the lives for many other people. But you never know. Someone you may talk to in this room today may influence your future, your treatment, learning something from other patients. And we'll talk about that a little bit more in the Living with NETs section. So without further ado, I'd like to introduce our co-presenter, Caring for Carcinoid, and the Caring for Carcinoid Executive Director, Ron Hollander. Please welcome Ron.
Good morning. Thank you, Giovanna. Giovanna has just been an inspirational leader in helping to put this together. And I just want to thank her and LACNETS for their amazing work and support over the years. It's a very special day, and I'm so glad that so many of you patients and families and caregivers are here to share it with us, because it can be life-changing, certainly course-changing, and we hear this year in, year out. I was glad to hear Giovanna's story. This is our 6th year doing a conference here at Cedars, and I think that's the longest that Caring for Carcinoid has been doing these kinds of conferences, and so thank you also. Very special thank you to Cedars. We have faculty today. I'm not going to go through the entire agenda because we want to keep it on time, but we have faculty today, the core group from the Cedars team, which you're going to hear a lot from today. But we also have speakers from 4 other organizations actually, and leaders from the East Coast, from Texas, as well as from Northern and Southern California, because we want to really bring to you the kind of perspectives, the kind of information that is really going to be the most helpful to you. And we can't do these conferences and make them happen free of charge without the incredible support of our sponsors, who you see up on the screen here. So a very special thank you to them, especially our 2 lead educational sponsors, Ipsen Pharmaceuticals and Novartis Pharmaceuticals, who really help us run these programs throughout the years. Our sponsors for today's program, and they each have tables out in the lobby for you to visit with them and learn more about what they have to offer. Lexicon Pharmaceuticals, Net Alliance, and also InterScience Institute are with us today. So thank you to all of you. Please visit with them. There's also a table in the back with information about both LACNETS and Caring for Carcinoid Foundation, which we hope you will find useful as well. As Giovanna said, I'm the Executive Director for the Caring for Carcinoid Foundation. I'm going to talk a little bit more about our research a little bit later in the program, where we talk about some of the exciting things that are happening now. But one thing I want to say to you now is, in the 3.5 years that I've been privileged to do this job, I speak to patients and families every day. And like I'm sure more than a few of you in the room here today are at your first conference, many of them are just starting their journey with neuroendocrine tumors and neuroendocrine treatment. And what they find is a very typical story. I was just talking to a couple this morning. They've had symptoms for years. They were misdiagnosed initially, as was the case with our founder. When finally diagnosed, had significant disease, often metastatic disease. And more troubling, found that their own caregivers didn't know very much about what they had, what their prognosis was, and that when they looked for information, there wasn't much information out there. And what was out there was contradictory and confusing. And it wasn't like in some other cancers where there are pretty clear treatment paths, and no matter where you go, you hear the same kind of thing. Very, very difficult to navigate, but you know, that's why we're here, and that's why we're here today. We are hoping that by the end of the day, not only for those of you who are new, but for those of you who are on the journey, you will be not only informed, but empowered with information about what's happening in terms of the latest treatments that are available, what's changing about those treatments, empowered with hopefully hope and excitement about some of the amazing things that are going on in research that are giving us such hope for better treatments and cures going forward. And we also hope empowered from each other, collaborating, meeting each other, meeting during the breaks, because this is, as Giovanna said, a very special community. And the strength that we all take from each other is just as important in terms of living with this disease as is the treatments we get within the walls of these wonderful institutions. So thank you for being with us. I'm going to do a very, very quick, since we're already over time, overview of today's agenda. I want to say at the outset a couple of things. One is we've already experienced the cell phone going off here, so if you haven't already, please silence your cell phones. There are also cards on your seats, and we have plenty more if you need them. There's going to be a lot of opportunity for questions in the latter part of the day, limited question and answer periods during some of the speaker segments. So we'd really like you to write down your questions as they occur to you so that we can compile them during the breaks. And as we especially get into the end of the day where we're going to bring all the speakers together, we hope we can fit them all up here, that we can really get to as many of your questions as possible, because we know how important that is as well. So please, if you can record your questions on those, and we'll also have microphones available as well. So following our remarks, we're going to get first some opening remarks from Dr. Nissen. Dr. Nissen, a surgeon here at Cedars, was one of the first people I met when I was on this job and came out for the LA conference. This is 4 conferences ago now. It's so fascinating, not only what he does, but but what's changing in the field. And again, Dr. Nissen, thank you for working with Giovanna and the rest of the team to really help make this day possible. Then we'll have an overview, useful for all of us, I'm sure, in terms of neuroendocrine tumors, how we classify them, the basic approaches to treating them. We'll take a break. We're going to ask you to please be attentive to coming back at the assigned end of break time so we can really get to all the speakers. And then I'll be leading a group, I won't go through them all now, talking about research and what's really evolving now in terms of new treatment modalities and some very exciting things around what we call immunotherapy that we're all have very high hopes for. Right before lunch, appropriately enough, we'll be talking about nutrition, what to eat, what to avoid, and why. Very useful, and then you'll see a very well-selected menu for luncheon items to hopefully keep you on track. And then after lunch, we have a couple of large panels, and then we'll be trying to get to as many of your questions as possible. We'll have the entire Cedar team, almost the entire Cedar team with us to talk about advances in therapy. They'll actually take us through, several of the faculty together, a tumor board to see how cases are actually discussed and the different perspectives that need to be brought to bear to answer what's next for patients. And then we'll take our final break, have some wonderful speakers, including Giovanna and someone many of you know, Josh Mailman, talking about their own experiences as patients. Again, opening it up to your questions, and especially opening it up to all of your questions in the final pretty much hour of the day.